Would you like to get accurate and timely blood lead test results for your patients? Follow along as we share some tips for completing specimen submission forms for the State Public Health Laboratory or the State Lab Blood Lead Lab. The State Lab performs over 3,000 lead tests each month, but around 2% are rejected due to submission errors. Even more are delayed because lab staff must contact providers to resolve issues, most often caused by missing or conflicting information on submission forms. Completing the form accurately and thoroughly helps prevent these delays and ensures faster test processing and results. Want to avoid a follow-up call from the state lab? Let's review what it takes to get the submission forms right, your specimens tested, and your patients informed of their results. It's easy. In the onboarding process for the state lab, you received a number of protocol documents. In the instructions for proper submission of specimens and receipt of results document, we have outlined all the details that must be completed on the submission form. Please don't leave any required fields blank. Let's take a few minutes to look at the areas of the form that create the most testing delays. These areas should be double-checked before submitting specimens to the state lab. The very first field on the form is the date specimen or sample collected. Please don't leave this blank. Laboratorians use it to determine if the specimens can be tested. Remember, all specimens should be sent the same day they're collected, and they must be received at the state lab within 7 days. In the patient information section, make sure to use full first and last names, not abbreviations or initials, and be sure to include date of birth and sex. Complete all of the remaining fields, including the patient phone number. Without it, we can't communicate critical results to the patient. Make sure the information on the form exactly matches the specimen labels and names on insurance cards. Please include all relevant insurance information. Like your practice, the Department of Public Health bills the patient's insurance carrier. Without insurance information, including secondary insurance if applicable, we can't do that. To make sure we're reimbursed for testing services, we'll need to follow up with you by telephone for this information, which delays testing. In the healthcare provider information section, include the name and address of the facility listed in the submitting facility block on the form. This is where the reports will be sent. Use the official name of your facility. Do not use abbreviations or shorthand designations. Any deviation from the official name and address of your facility will cause delays in reporting results. We also need the physician's National Provider Identifier, NPI number for billing. We frequently receive forms without this information, requiring us to give providers a call, which also delays testing. Include the medical record number, MRN, and make sure to check off the appropriate diagnosis code so the lab knows what to test for and can bill properly. Common blood lead diagnosis codes are Z13.88, Z00.121, and Z00.1294. Submission forms should be folded and enclosed in the outer pocket of the biohazard Ziploc bag. Do not affix tubes to the forms with adhesive tape. One final request from the lab staff. If you're handwriting the information on the forms, please make sure they are legible. All results will be communicated through the ELR portal. If you're not on ELR or need to update users, send an email to elr.support@mass.gov to get on board or updated for reports. To learn more about specimen collection and shipping, make sure to check out our other video, How to Submit Childhood Blood Lead Screening Samples to the Massachusetts State Public Health Laboratory. If you have questions or need more information regarding testing, use the QR code to link to mass.gov, or for questions about results, please call Laboratory Client Services at 6179-836665. Specimen collection fingerstick capillary tubes, submission forms, biohazard specimen transport bags, and outer pre-printed cartons are available, free of charge by calling 617-983-6640 or email MA SPHL, specimen kit orders @mass.gov. Use the QR code to generate an email for ordering. Thanks for watching.